How to tell if you are hallucinating. Hallucinations involve sensing things that aren't real, affecting 5 to 25% of people. They can impact any sense and vary in frequency. Understanding and distinguishing hallucinations from reality is crucial for mental health. What are hallucinations? Hallucinations can be a terrifying and confusing experience. They are more common than people may think, with up to 5 to 25% of people in the general population reporting experiences of hallucinations. It is important to understand what hallucinations are, how they can affect mental health, and how to distinguish between a hallucination and reality. Hallucinations occur when a person perceives something that is not real. These perceptions may involve any of the senses, such as seeing objects or people, hearing voices or sounds, smelling odors, tasting flavors, or feeling tactile sensations. While some people may only experience these sensations on rare occasions, for others, hallucinations can become a daily occurrence. The relationship between hallucinations and mental health. It's essential to understand the relationship between mental health and hallucinations. While a hallucination in itself isn't necessarily an indicator of poor mental health, it can be a symptom of certain mental illnesses such as schizophrenia, depression, bipolar disorder, and anxiety. Sometimes hallucinations can be caused by drugs, alcohol, or medical conditions. It can also be a side effect of certain medications. Therefore, it's important to understand the potential causes of hallucinations and take steps to get help if needed. Overview of hallucinations. Hallucinations can be a frightening experience, especially if you do not understand why they are happening. It is important to be aware of what hallucinations are and how they relate to mental health conditions. Hallucinations are false sensory perceptions that occur without external stimulation. They often involve visions, hearing, and smells that are not actually there. Common types of hallucinations include hearing voices, seeing things that are not present in reality, and having unusual bodily sensations. Mental health conditions can cause hallucinations. Some common conditions associated with hallucinations include schizophrenia, bipolar disorder, and post-traumatic stress disorder, PTSD. Hallucinations are also sometimes associated with substance abuse, including drugs and alcohol. It is important to remember that not all people who experience hallucinations have a mental health condition. However, people who do have a mental health condition are more likely to experience hallucinations. If you are unsure about what might be causing your hallucinations, it is important to speak to a mental health professional. They will be able to provide the necessary support and treatment you need. Hallucinations can be divided into 3 main categories. Visual hallucinations involve the person seeing something that isn't actually there. This can be shapes, colors, people, animals, objects, or patterns. Visual hallucinations may sometimes appear to be realistic and lifelike, and may seem to move with the person's movements. Auditory hallucinations involve hearing voices or sounds that don't exist. These can be anything from a single voice talking to the person to multiple people talking at once. The voices may seem to be coming from an external source, such as a radio, or from within the person's head. Tactile sensory hallucinations involve feeling something that isn't real. These can involve a range of sensations, from feeling a presence in the room to feeling bugs crawling on the skin. Diagnosing hallucinations. The first step in diagnosing hallucinations is an initial assessment. A doctor or mental health professional will want to get an understanding of your current mental state as well as any past experiences you may have had with hallucinations. They will ask questions such as, how long have you been experiencing the hallucinations? And what do the hallucinations feel like? The second step is a physical exam. The doctor may check your heart rate, blood pressure, and temperature, as well as look into your eyes and ears. This will help determine if the hallucinations are caused by a physical illness or if the cause is more likely to be psychological. The third step is a mental health evaluation. This involves completing tests, such as memory ones and personality inventory. The doctor or mental health professional will also discuss any potential substance abuse, as this could be a factor in the hallucinations. Once all of these steps have been completed, the doctor or mental health expert will form their diagnosis and recommend appropriate treatment. The diagnosis may vary depending on the cause. For example, if the hallucinations are due to a mental health condition, the doctor may diagnose a specific disorder, such as schizophrenia or bipolar disorder. However, if the cause is found to be physical, the doctor may diagnose epilepsy or a brain tumor. It is important to remember that the process of diagnosing hallucinations can be long and complex. However, the doctor or mental health professional should be able to provide support and advice throughout the process. It is also a good idea to have a friend or family member with you who can provide moral support. If you or someone you know is experiencing hallucinations, make sure to get professional help as soon as possible. Diagnosing hallucinations correctly is essential for finding the right treatment. Hallucinations can be caused by a variety of factors. It is important to understand and identify the cause of these occurrences, as it affects how best to treat them. Some potential causes include drugs, psychiatric conditions, trauma, or sleep deprivation. Drugs. The use of some drugs can lead to hallucinogenic experiences, such as LSD, psilocybin, MDMA, ketamine, and mescaline. These drugs can have powerful effects on the user and can cause hallucinations that are vivid, intense, and realistic. Psychiatric conditions. Certain psychiatric conditions can also cause hallucinations. These include schizophrenia, bipolar disorder, and substance-induced psychosis. People with these conditions may experience delusions, visual disturbances, and auditory hallucinations. Trauma. Traumatic events can also result in hallucinations, most commonly through post-traumatic stress disorder, PTSD. People suffering from PTSD may experience flashbacks, nightmares, or vivid memories of traumatic events. This can lead to intrusive thoughts, nightmares, or auditory hallucinations. Sleep deprivation. Sleep deprivation can also lead to hallucinations. When a person is not getting enough sleep, it can lead to an altered state of consciousness. This can cause the person to have vivid dreams or dreamlike experiences during waking hours. Sleep deprivation can also result in distorted sensory processing, which can cause hallucinations. It is important to note that hallucinations can be caused by a variety of factors. It is important to identify the cause of the hallucinations in order to find the best treatment option. If you are concerned about your mental health, it is important to speak with a healthcare professional as soon as possible to get the help you need. Strategies to cope with hallucinations. Hallucinations can be a very distressing experience, but there are some strategies that you can use to help cope with them. Relaxation techniques, mindfulness, and other therapeutic techniques can be beneficial in learning to manage the effects of hallucinations. Relaxation techniques involve using breathing exercises or visualization to bring your body and mind into a relaxed state. This can be done either in a structured way, such as through mindfulness meditation, or simply by taking a few moments in your day to focus on relaxing your body and mind. Another strategy is mindfulness. Mindfulness involves slowing down and paying attention to the present moment without judging it. It is about being aware of your thoughts and feelings without attaching any emotional significance to them. Practicing mindfulness on a regular basis can help you become more aware of your own thoughts and reactions, which may help you better manage any difficult feelings or sensations that come up when you are experiencing a hallucination. Cognitive behavioral therapy, CBT, is another option that can be used to help manage hallucinations. CBT is based on the idea that our thoughts, feelings, and behaviors all influence each other. The aim of CBT is to understand and challenge negative thought patterns that may be causing or exacerbating the hallucinations, and then to develop positive coping strategies to help you manage them. It is also important to seek professional help if you are struggling with hallucinations. A mental health professional or psychiatrist can provide advice, medication, and treatment to help manage symptoms of the condition. Other self-care activities that can help with managing hallucinations include exercise, ensuring adequate sleep, eating a balanced diet, and engaging in activities that you enjoy. Taking time to look after yourself and to connect with loved ones can also help to ease the distress associated with hallucinations. You may find it helpful to keep a diary to record any experiences of hallucinations or note down any strategies that work for you. This can be useful for further tracking progress and seeing how your strategies are helping. Making lifestyle changes can also help when managing hallucinations. Avoiding alcohol, caffeine, and other drugs that can increase or worsen the effects of hallucinations can make a significant difference. Finding ways to manage stress, such as through yoga or mindfulness, can also be beneficial, as can attending support groups or talking to a counselor or therapist about your experience. Although hallucinations can be difficult to manage and frightening to experience, there are a range of strategies that can help you cope. With the right support and coping strategies, it is possible to learn to manage the effects of hallucinations and live a more meaningful life. Hallucinations can be deeply disturbing and can make it difficult to live a normal life. But there is help available and treatment options that can help you manage your hallucinations and move forward in your life. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.